everybody, we're back today with a continued discussion on our three-part series about your balance, and today we're going to talk about what a comprehensive balance assessment looks like here.
Hi everybody, I'm Dr. Michael Squires.
And I'm Dr. Carly Squires.
And this is Dr. Squires Squared.
This is a channel where we have candid and casual conversations about anything and everything audiology.
And if you're not sure what audiology is, make sure to like and subscribe to the channel. Hit the notifications bell so you get all of our new content, and we're going to tell you everything you'll need to know.
Okay, so last time we talked about why an audiologist would have anything to do with your balance or why you're dizzy and why we would assess something like that and why it's in our scope of practice. So today we're just continuing on that road, on that discussion, and we're going to actually talk about what a comprehensive balance assessment looks like, in specific here in our office. What kinds of things are we testing for? What are we looking for? What does it mean to be dizzy and what you should do if you are dizzy or experience those symptoms? So let's kick it off.
Okay. I think the best question is, what is dizziness? I mean, what is...
Yeah.
Dizzy is kind of an umbrella term, I think.
Is.
One thing I typically ask my dizzy patients is to describe their dizziness without using the word dizzy, because oftentimes that really helps to kind of separate what the true symptoms are.
That's right.
Some people will describe dizzy as what they're actually experiencing as a lightheadedness or like room spinning, or they feel like they're spinning, or a multitude of different explanations.
I've heard people describe it too as just feeling out of sorts,
or just like woozy, or like off balance, or disequilibrium.
Yeah, so there's so many different descriptions, so many different things that you could be experiencing, and it really is individualized per patient. So it is so important to be able to describe that.
Well, not only is it individualized per patient, but it's individualized per problem or etiology or whatever you want to call it. That's one of the reasons why we do the balance assessment, is to make sure that we are getting, like you said earlier in our practice round, getting to the root cause of what the patient is actually experiencing, because so often balance issues, true balance issues, go either mistreated or untreated, or treated as something else, whether it's prescription medications or whatever it might be. We hear so many people talk about putting the crystals back. Well, that's just a very small segment of the population where that actually is going to apply to the issue. So I think that lends itself well as a nice segue into what the balance assessment looks like and why do we do it.
Right. And we alluded to this last time, as there's so many different causes for dizziness or imbalance. And it's really difficult to really pinpoint that without a true assessment, which is why we're doing what we're doing. Rather than just guessing, this will either rule in or rule out that the inner ear has something to do with this balance issue or this dizziness issue that you're having. So if you are dizzy, if you're having any symptoms that feel like that dizziness, imbalance, first thing you should do is tell your primary care physician. Definitely talk with your physician about that. And then that way they can make the appropriate referral, hopefully to an audiologist that has a balance center or balance protocol set up, so that we can then get to the root issue going on. So then you would actually come here or to an audiology or vestibular clinic for those testing, and then what would that look like?
Well, you said something really important there. The goal of what we're doing is to rule in or out the possibility that the inner ear is contributing in some way. And although some of our testing does involve the central nervous system, that's kind of a wonderful bridge between our last episode and this episode. Is we're kind of focusing on the peripheral systems as a cause of some of these issues, which we know are found in the ear. So being that they're found in the ear, they're also closely linked to the auditory system. So the first thing we typically do is assess hearing in some way, shape, or form. Whether it's through a traditional hearing assessment, making sure that there's no asymmetries or that reflexes are working the way that we would expect them to work. There's no fluid in the middle ear or something like that. And it can go so far as even, assessment of electrical activity within the inner ear or intracochlear pressures, fluid pressures, just to make sure that we're ruling out things like Meniere's disease, or what we sometimes refer to as cochlear eye drops. Maybe we'll do some videos on what all of that means later. But ultimately, we've got a list of boxes in our head that we're just checking off as we go down through the list from the auditory perspective. Once we get done with the auditory assessment and make sure that the auditory system is functioning properly, then we move on to the actual vestibular or balance system itself, which is kind of a good time to talk about what is important for balance. Well, there's 3 systems that are really important for balance: visual, proprioceptive, which is basically the brain's ability to tell what's underneath your feet, right? How your body interacts with the ground and the environment around you. And your vestibular system, which is held in your ears. So your eyes, your ears, and your brain all work together to keep us up and moving appropriately as humans. So we first start with central nervous system. We run a quick test of kind of what we call a central battery, which lets us know that the eyes, the ears, and the brain are all coordinated. They're all working properly. Our eyes are moving together in response to some type of stimulus that we're providing. Then we move on to the peripheral vestibular system. We can assess the peripheral system in a couple different ways: moving the head in certain positions, or the body in certain positions, laying down, head right, left, that sort of thing. We can also basically trick the brain into thinking that it's turning around in a circle by changing the temperature of the vestibular system. So whether we're using air or water, we can actually put warm air or water, or cool air or water into the ear, which changes the temperature of the system. And much like the thermocline in a lake, or warm air rises and cool air sinks, in that respect, same thing happens with fluid in the inner ear, and we can actually take measurements of how the right ear is working compared to the left ear. And we can come up with any weaknesses that are present.
Right. And so depending on what we find on those assessments, which it is a lot, I mean, it's a very comprehensive look, and it does take some time, so it is a little bit of a longer appointment too. But we get a really nice snapshot about what's going on in the inner ear and as a whole, and then we get a glimpse into what's happening then with that connection to your eyes and your brain, all of that. And so that, again, puts together a big picture about what's going on. We assess that, and then what's unique in our office.
Then we move on to proprioception.
Yes, exactly. So it's unique in our office that you get to go down and see a vestibular physical therapist, meaning we have a physical therapist here from Mountain River Physical Therapy that specializes in balance or vestibular issues. And based on the data that we provide, he's able to treat and help with a plan of care that helps you get better a lot quicker. Right.
Here's the thing. What's the point in doing an assessment or doing any type of testing if you don't have a means of appropriate follow-up? It's like, a primary care physician who specializes in seeing people with diabetes but doesn't know where to send them, or to a specialist or something like that.
Yeah, we all have to work together, and this partnership has worked really well. And I think that was one thing before we incorporated all of this in one appointment. There was a little bit of a loss to follow up or a little bit of a disconnect, but now that we're all under one roof, I think we've seen a lot better outcomes, first of all.
Absolutely.
And then just a better patient experience because you're having that entire picture looked at one time. So it's been really successful.
Yeah, it doesn't make any sense to send patients out of the clinic with a partially put together puzzle. We want to get all the pieces of the puzzle, put it together, coordinate with the primary care or ear, nose, and throat or whatever referring physician is that we're working with. We want to give a really comprehensive look to both the patient and that physician so that we can directly assess and directly treat the issue. Because many times balance issues, we can fix them, or we can at least manage them really, really well and improve the quality of life for patients through those better outcomes. We see therapies going more smoothly, they're more direct and individualized for patients, and not to mention they're shorter and the outcomes are better. So I mean, it's a perfect scenario to work with a physical therapy group like that and a trained physical therapist.
Yeah, and we'll get into that in more detail next time as we wrap up this series. And we're actually going to have Dr. Chris Covert here from Mountain River Physical Therapy, and he's going to kind of dive in with Michael about what he does with all of the data that we provide him for these patients.
Yep.
So stay tuned for that.
Yep, it'll be a good one.
So if you have any questions about anything that we've went over today, any of these topics, please email us at info@hearwv.com or leave a comment, like and subscribe. Call our office if you'd like. It's 304-428-2403. And until next time, thank you.
See ya.